It's a delight and privilege to catch up with Mr. Thulasiraj Ravilla, Executive Director, LAICO, Aravind Eye Care System. Thank you so much for your time.
Thank you, Vinod.
Yeah, and you are someone who's achieved so much in the public sphere. You were a Schwab fellow in early 2000. You've been invited many times to the World Economic Forum. You were considered one of the 30 most influential public health people, globally. The Times of India awarded you for being, the public health champion in what you do in 2014. You got a degree from IIM Calcutta, and you worked in the business world before you came and took up a role in a small non-profit and nurtured that into something, what it is now. So just wondering, what kind of advice would you give for some other small non-profit if they are listening to this and they want to learn a few things on what to do and what not to do?
It's a very, very broad question. I'll try to be as concise as possible. And I'm going to be a little bit more biased from a management perspective. The reality is that when it comes to caregiving, whether it's eye care or any health caregiving, there are two very distinct components. Now, one relates to the clinical care given to each patient who presents themselves, which requires a lot of clinical acumen, training, equipment, and so on. And then the other aspect is to build that ecosystem within the hospital and even beyond it, which will make that caregiving process to work much more efficiently. Right systems in place, processes, coordination, micro-planning. There's a whole lot of things that need to be done, which typically would be left to chance that it will all happen well, and if it doesn't happen, a lot of firefighting happens. So I would say if it is one important advice is to have this recognition and then pay equal attention to building both. Otherwise, typically all the attention goes on the clinical side, buying the latest equipment, hiring the best surgeon and so on. But I think focusing on this aspect, and that's essentially what we brought into Aravind as well.
And you played a big role nationally within the eye care sector. You were the inaugural president of Vision 2020, where this whole aspect was at one stage. Now, over the last decade, since you've been president to now, what do you think has changed within the sphere across the country, and where do you think the state of this sector would be maybe 2 decades from now?
So this, everyone talks of cooperation, collaboration, and especially public-private sector and so on. So this whole, and then when globally WHO and IAPB launched the Vision 2020 initiative, there was a sort of alignment and coming together of different agencies. And I was quite involved in with WHO or IAPB as the regional chair. And then as I was stepping down, we decided to bring in that focus into India as well. So India became one of the first countries to launch Vision 2020 India. And then that basically, the big picture was how do we work with the main stakeholders, with the government and private sector and industry and so on, to create that synergy to take Eye Care India to a whole different level. That was the broad picture. And of course, there were some very specific directions and goals. And that's what we pursued. And over the years, we achieved quite a lot. Like for instance, we had the World Bank funded cataract prevention program, which kind of gave an outlay of $100 million that was spent over a period of 7 or 9 years, I think. And then that built countries' capacity to quite some extent. So leveraging that, we were able to negotiate with the central government, ourselves, and also in collaboration with the Ministry of Health, to significantly enhance the budget allocation for 5 years. Almost, in fact, it was quite a bit more than the budgetary allocation that was made under the World Bank project. So we were able to bring about that kind of an alignment and movement, and then a good foundation has been laid, for going forward.
And in 2 decades from now, I mean, what big changes can you? I know it's so hard to predict what might happen in the future, but if you got to kind of highlight 1 or 2 things that might happen, what would that be?
I think going ahead, I think for eye care, there is a very interesting time period, I would say. One, I think the demand is going to skyrocket for multiple reasons. I think for the very first time, the World Health Organization and the global leadership has recognized the centrality of quality in a much more holistic manner. And then they also, for the very first time, they have stipulated thresholds for when to intervene and what should be the outcomes. Like it's stated as 612 now, which means lens change with a vision less than 612 would be offered a cataract surgery. So for the first time, I think the whole thought process changing, that you prevent blindness. Otherwise, we're always trying to get rid of blindness. So I think, so once that happens, I think the need for eye care is going to skyrocket. And then we're also finding tremendous advancements in technologies, which I think will democratize the caregiving process. And we're also seeing the unfolding of primary eye care through vision centers, which will make it much more inclusive of people to come in. So all in all, I think it's going to be an exciting 2 decades, coming ahead.
Yeah. And you've been, kind of expressing your views on the whole issue of, rethinking finances, financial models. Just wondering whether you could comment on 2 things. One is, for an NGO, for them to be financially sustainable, what are aspects they should keep in mind, including, revenue raising from different, avenues. 2, the second aspect I would like to hear views on too is giving everything for free a good idea? Or do people value it better when they pay a small cost?
Yeah. So at one level, we'll have to respect a particular NGO's philosophy as to whom they want to target. If they want to serve only the poor, I think we should respect them, and they should figure out how to build their own capabilities, finances to do that. But overall, what will work really better and sustain much longer would be to come up with an inclusive model, where you're able to serve the poor, serve the rich, and have that design which is really inclusive. When I say design, it's about pricing, it is about access, because somebody who is very poor, very rural, may not be able to access. So inclusive design should also address that. I think once you do that, I think at least in India and in many other countries that we have worked with, the distribution of the segments that can pay something, that can pay nothing, I think if you serve all of them, you'll still be able to manage it with the total revenues that you get. So you would have some free patient, and there's a lot of synergy between between all of them. So my advice is to really go for inclusive design because that will give you overall financial wherewithal, as well as build a lot of trust in the community, to kind of sustain the demand. Yeah, and that's what we should move towards.
Right. And the thing about giving for free to getting the end user to pay, have you noticed do people value it better when they pay something, or if you have an option to do both?
I mean, this has been talked about a lot, saying that if you don't charge, it won't be valued. I somehow don't subscribe to that now, because I think people are intelligent. Even a poor person, I think, has got, they recognize what is important. But if you're just giving away something for free, people may just take it for this because it is free.
Right.
So that way that will be wasteful.
Yeah.
So you really want to make sure that people are getting it because they need it.
Right.
And let's say, for example, somebody comes to a hospital, or to an eye camp. They are spending resources to get there.
Right.
Just because you don't charge anything for whatever service you give, or for a pair of glasses, it's not free.
Yeah.
Because they've invested half a day, wages lost, bus fare, all of that has gone in.
Right.
So I think we'll need to be more respectful of that. Yeah.
No, I think that's a good observation. So thank you so much for your time, and it was a delight.
Thank you, Vinod. Happy to be part of this.
Thank you.